Perfect. So as you know that today we are actually talking about how to study for ADC. Now, you know the material, you know the files, you know the app, and you know the study plan. Everything is provided to you. You guys have taken off your preparation. You've officially started the March 26th exam preparation, which I know now you're getting familiar, you're gaining momentum, you're seeing how much time, particularly watching any lecture takes, then reading a particular hot note takes, or then assessment quizzes and mocks that you take every day. You're from getting yourself familiarized with the entire protocol and the entire program. So after that, but I still wanted to take this class in guiding you, in helping you what the approach should be towards preparing, because you have all the material, but also it's important that you learn and you understand how to utilize the material and then you use it to gain as much knowledge as possible so that you can apply those concepts to the existing questions that we have in Mega Master file, Ultimate Advanced file, and Ultimate Advanced file volume 2, but also in the examination when the newer questions come. So when the examination happened, like in the last 2-3 times, people have noticed that sometimes the examination is predominantly absolutely new unseen SBQs, and sometimes there is 50-50% balance of unseen questions and familiar questions. And then like this time it was about 70-80% familiar questions and similar SBQs, and only 20-30% new ones. But even the repeated ones and even the familiar ones, they come with the variation. So our students, when they go for the exam and then they come back that the paper felt easy or the paper felt very doable, can anyone tell? Because the exact copy paste, even the 70 and 80% doesn't come exact copy paste. But still, our students come out and share the screenshot and they share the sentiment that they felt that the examination was easy. You've seen that in the WhatsApp screenshots that I post on the group as well, right? Everybody, I want to know that you've seen that common feedback, right? So now, can anyone on the chat tell me what do you think makes it that even if the 60-70% SBQs are familiar, but they are not exact same, and there are changes in options and everything, but the candidates come back and they have that, if I'm, if I can quote that, and if I can really coin that term today, would be the wind spirit confidence. So the wind spirit confidence that comes out during the examination, and when the candidates come out and they say whether the examination was entirely new or it was quite familiar, it is because of the fact that the conceptual knowledge that we acquire during these 22 weeks, and the MMF and the UAF and the UAF2 questions also that we do. If you have taken my classes, you know that I do not promote memorizing the answers. I do not promote, memorizing the concepts, but understanding them. And the rash technique, which is the biggest, I think, invention that we have done during the live classes, is to conceptualize, is to understand that no matter whatever changes in the questions, whatever variations come, how to still utilize the concepts and apply those to the questions. And that confidence gets reflected during the examination, and that is why our candidates come out and tell that it was an easier exam. So people can go out and mock, people can go out and say things, oh, examination was tough, don't listen to her because she says that her candidates are saying it was easy. Don't I make it easy for you. That's my job, basically. So if somebody out there thinks it's a tough examination, oh, it's this bad, it's that bad, let them be. If you come to me, if you join Winspert program, my job is to make it easier for you. If I'm not making it easier for you, I'm not doing my job. As simple as that, right? So if I'm not making it simplified, if I'm not making it easier, and if I'm not making you stronger than I am not doing my job. As simply put. So yes, people who think that it can't be easy, that is because they have not experienced how we do it. And I want to give you the taste of how we do it. Okay, how we make it easy. So everyone here, when we say A to Z, it's about not just A to Z, it's about how we make ADC Part 1 easy. Okay, that rhymed, right? Probably I'm in love. All right. So let's learn how to make ADC easy and also learn A to Z. Is everyone ready here to learn how to do A to Z preparation and how to make it easy? Now, there will be a lot of free groups that you would be part of, right? And they would be telling you stuff like, you know what, go read this book, go read that textbook. For operative, read Mountain Hume. For prosto, read McCracken RPD, Dalhousie, Carenza. Oh, you need to read those books. It's on the ADC list, handbook list, and everything. Yeah. Yeah, you've seen those groups, right? And I have huge respect for free groups. Trust me, I have my own and I respect all the free groups and free help that there is. But there is still some misinformation, even whether you're preparing with a course or even you're preparing without the course. You cannot in 5 months read all textbooks. You cannot. Even when I took the examination, I did not do a course and I prepared for 10 months, but still, mind you, my approach was not entirely textbook. It's a wrong approach. The examination is clinical. The examination is very, very guideline oriented, contemporary guidelines, contemporary clinical studies, the case reports, and the contemporary methods and the preferences of materials. In textbooks, they talk about all the materials, all the treatment options, all the possible available treatment options, but it's in the guidelines, it's in the ADJ articles where you will learn what is the preferred clinical method, and that requires research, that requires time spent on reading the guidelines and articles, and that's when you ultimately come to the final answer. Now, as the ADC sample papers were released, again we saw the 97% of the answers matching, right? So again, the claim saying that she's not practiced in Australia or she's not there, she's not registered there, none of the academy even touched those sample papers because their answers were not even matching. I took the classes on all the new questions on the sample papers. Remaining questions, almost out of 200, only 39 questions we had to do. Out of those 39 also, only 20 were variations and 20 were new. So out of 200, only 20 questions I have not taught in the files, and out of those 180, 97% answers matched. So it is not about living in Australia or practicing in Australia. A lot of practicing Australian dentists may also not know what is the standards and the highest recommendations now, right? And that is why it is not where you're located, where you're practicing. It is about who is researching the most for the clinical guideline, who is working their ass off. This person is. And that is why we get the 97% accuracy rate in the ADC release sample papers. So it is not about where I practice, where I don't. It is about whether I study for my students or not, whether I get them the latest references or not, and whether I get them the latest articles or not, or do I dump them in the big textbooks and I tell them because it's on the ADC reference list, go dig in the textbook. That's not my job. That's like doing my heart. That's like I am putting all the hard work on you and reaping all the benefits. No, if I'm running a program, my job is to work hard myself and take that load off you. Otherwise, you don't need me. As simple as that. So now why you need me and why you need this program and how you will use this program, let's talk about that. All right. Now, first of all, we know that we prepare for this examination cluster-wise. All the subjects, all the disciplines of dentistry are divided into 4 practical ways to deal with the patient. One is when the patient comes to you, tells you the chief complaint, you start investigation. You start doing examination, investigations. That's your information gathering, collecting the history, chief complaint, all in and out, clinical exam, investigations, everything included in information gathering. That's your first cluster. When you join the program, you will see on the app there are separate lectures that I've already taken for individual clusters. So if you go to the plan, you will see the study week, the week wise study plan is made available for you, right? You've already started from week 1, day 1. Everybody here, right? Those who have enrolled have started with their week 1, day 1 study plan. If you go to the sections below, you will also get this special webinar section, the special classes. And if you go in the special classes, there is cluster and exam process classes. So I have explained individually how each cluster is asked, what in each discipline includes that. So please make sure to watch these cluster wise lectures to get complete in-depth understanding. Now our Mega Master file, our Ultimate Advanced file and Ultimate Advanced file volume 2. In all the questions, I have marked clusters for you, right? If you go to individual questions, in front of each question, you will see I have marked treatment and evaluation, or DM, which is diagnosis and management planning, or IG, which is information gathering, or PH, which is professionalism and health promotion. All the 4 clusters, every single file, which is your Mega Master UAF 1, which is Ultimate Advanced File Volume 1, and Ultimate Advanced File Volume 2. In all the classes, I have marked the clusters for you. And then on the app again, when you go there, you will find the cluster-wise mocks as well, right? So we have cluster-wise mocks too. Now that I will not recommend to do as of now, but as you will progress into the program and when you start taking all the mocks, you will see where you're making more mistakes. And in 2 months or 3 months after doing all the subject wise weeks, you will then start to, get an idea which cluster is your weakest, because then you will get your mock results also cluster wise. So then you will know which is your weakest cluster, which is your strongest cluster. So in the 3rd month of the program or the 4th month of program, you can start practicing on your weaker cluster. So we have cluster wise mocks as well. Can you all see on my screen how we provide even cluster wise mocks? No other academy is giving you cluster specific mocks, focusing just on one cluster. And we have about 4 quizzes. One quiz may include 60-70 questions, so somewhere about 400-500 questions on each cluster to practice. So now this level of practice, this level of detailed, nuanced, microscopic preparation which Winspert sends you with to the examination center, no one even dares to work that hard and teach you that. Right? But I'm not scared of this humongous work that has been gone behind it. And that is why we make it easy. See, one thing that looks effortless requires the maximum effort behind it. Would you agree with that? What looks effortless? Things that look effortless actually have the maximum effort going behind them. And that is what we do together, you and I, in 22 weeks. So are you ready now with me in the coming 22 weeks to give your maximum effort? And I'll give you my 200%, you give me your 200%. And on the examination day, trust me, we'll make it effortless. And let actually the trolls really wonder. And I really invite you to go and use those groups, please, that you do during my lectures. Please be my guest and go publish more, because that's my fuel. That makes me work even harder for my candidates. So please be my guest. Write as much as you can against me, because that fuels me, right? I see it every day. Initially maybe it bothered me or not, but now it is what I thrive on. So I love it. Those are my blessings too, right? That means I'm doing something right, which people cannot stand and have to go and vent out somewhere, right? So trust me, what really is a resentment in them is actually positivity for me. So in all the ways, it's helping me win. So please be my guest and do it more. Now look at this. You have Mega Master assessment quizzes. You have now your 1,000 assessment quizzes, your UAF assessment quizzes, your X-ray mocks, your infection control guideline mocks, your ADA policies mocks, right? Then your therapeutic guideline mocks. Every single mock is available for you to master it. Exactly, Divya. I tell you, right? There is just energy. There is no good energy. There is no bad energy, Divya. There is nothing. There is pure energy. It is up to you how you transmutate it. Use it for your benefit. Trust me. Their negative energy can become my positive energy. What else? In fact, it is not even my energy. I'm using theirs to work even better for myself. So they're giving me their energy. So trust me, when people put you down, when people talk against you, they're giving you their energy. Use it and convert it positively. Now that's up to you how you use it. It's a gift. Imagine somebody giving you their time, somebody giving you their energy, somebody giving you their thoughts. Isn't that a gift? Be it negative or positive, that's a gift. They have given it out of their system. It is now up to you to transmutate it into for your benefit and use it. Use it for your benefit. So people giving you so much attention, use it for your benefit, but transmutate it positively first and then use it. You can easily protect yourself and move ahead because there's something bigger watching out for you. And when you're at Winsport and I know the program is intense, right? You all know the program is intense. Trust me. You might be teeny bit hating me for that. Why does she say it's a 5 to 6 hour program, but when I start doing it, it stretches to 7 to 8 hours? Trust me, you get that feeling? Tad bit, you're like, Jigyasa, you're a lawyer. You tell us that it's a 5 hour program and a 6 hour a day program, and then it spreads to 7 hour a day or 8 hour a day, right? It's fine. I know how much I make you work. I know I'm hard on you. I know I send you maybe 5 questions in the morning and 5 questions in the therapeutic guidelines in the evening. So 10 questions every day I'm making you practice on WhatsApp. Every day this intense study plan I'm making you work. Facebook also I'm throwing a Pioneer SBQ on you every single day. I force you to do that. So I know I'm making you work hard so much without even officially starting the program. So imagine what will I do when we start, right? But UF2 will be completely ready. It was 43-page file, and now it is going to be 77-page file. So we are going to start afresh entirely. All the UF2 will be starting fresh from October 1st week. So everybody's clear with that, what's coming up in the October 1st week. So Tuesdays we'll go on, we'll have our public session. And Thursdays we will have our internal UF2 classes. Sounds perfect? 43 to 77 too, but yes, 43 to 77. So it's almost doubled, right? Now, what I'm going to do today, QBank is the 1,000 and past papers combining, right? So yes, the merging is happening right now. We have eliminated the old concepts. We have adjusted the language. We have updated the references and answers. We are merging the past papers in 1,000. So we are at that stage, Tanveer. We are merging the 1,000 and past paper. So probably in 2 to 3 days, the merging will complete, and then Apurva will start creating the mocks. We'll take off the 1,000 mocks. We'll take off the past paper mocks, and we'll start uploading subject-wise winning edge QBank, one subject at a time. Once we do that, then we will also start, Tanveer, adding the feedbacks and explanations of those questions. So now the students who were cursing me for the classes and 4 hour to 7 hour thing, what you can do is you can not watch those 1,000 classes and only do the winning edge Q banks because the explanation will be part of it. right? Divya, so 1,000 classes are already there, right? Those who have time, please watch the 1,000 classes, 100%. But those who are really struggling at time, the Winning Edge Q Bank will have the feedbacks and explanations from the classes itself. So me and our team is working on actually adding the class concepts under the questions. So if you do not have enough time, cannot watch classes, when you do the mocks, the feedbacks and explanations will provide you the transcript of those classes. Got this? So those who have time, do it both ways, but don't who are really struggling at time, because I understand it. Some of you can be really mamas and daddies of very young kids, very young babies, or have jobs which are like throughout the day. I do understand that. So for you, the Winning Edge Q Bank will include the 1,000 and past paper question practice along with the transcript explanation under each question. So if you want to read and don't want to watch, both. And if you have time, if you're in India, you have help system, support system, or in any other country, you have support system, you have time, please do it all. So 1,000, Priyanka, has been actually added twice on the study plan, right? Thousands has been added, 1,000 classes has been added twice on the program. If you have seen it. So it is added on the first 8 weeks, that's there, right? For the first 8 weeks, all the thousands are there. Then if you go and week 9, after week 10, see, week 10 onwards, you start 1,000 again. See, Priyanka? You start revision again. So those who are watching it, I want to get the maximum benefit out of it. So they will watch it twice. And imagine you wanted more reading, right? You said that I want to read more and I don't want to watch class more. So, and today's class is for you that if you're not much of a webinar watcher and if you're more of a reader, I'm going to show you all the reading material here. Thank you for commenting, Anne. I was thinking of you when I was talking about the Q Bank. Q Bank will be uploaded on the app in another week. And then the feedbacks will also be added to them from the thousands and past papers merging. And even for MegaMaster, for your Ultimate Advanced File and Ultimate Advanced File Volume 2, all the power notes, hot notes, and mind maps is all reading material. And so I'm going to show you that. Everybody, are you ready now to see and learn how to prepare for ADC? Third surprise, Tanveer. Okay, I was thinking to reveal that in our October sessions, but maybe I will talk about it today. Okay. Any technique for low percentage people, Priyanka? Exactly that's what the surprise is about. So I'm going to talk about this today. Okay. So stay till the end because I'm going to be telling about the third surprise too. M till October 1st. After this, before October 6th, I will have few academic classes as well, right? TG mastering tips as well. So we'll have another class on how to master TG A to Z like we are doing today, ADC A to Z. I'll show you the TG A to Z class as well, Nikita. Okay. So what I intend to do today is I plan to take up this SBQ, a sample SBQ. So today is also a kind of an academic class. UF2 classes will start, Sophia, from October 6th week, that Thursday. So I wanted to take this class today, show you an academic way of learning and doing the plan. So just taking the sample SBQ from UAF2. One device only, M. Yes, this one. So you will see this particular SBQ covers a lot of disciplines. I'm going to show you how. It's talking about infection control guidelines. It's talking about periodontology. It's talking about RPD. And I'm going to show you how in the UF2 classes, you're going to prepare the SBQs with me. And then on the reading material, how your concepts will be reinforced, consolidated, and they will come together and you will apply. So, how to make sure that in the exam, when the variation comes and you're not thrown off and you come back and tell me it was easy. That's what you want to do or not in the examination day. That's the process. That's the widespread confidence we are aiming for, right? To go on the examination day and come back, even with the new questions, come back and say, yes, I could do it. It was easy for me to understand and apply. And the confident answers were marked. So I'm going to show you how this entire system will work for you. So the OPG was given to you. There were absent upper posteriors for 5 years and severe bone loss was seen. Lower anterior teeth showed less bone loss. Upper arch showed more resorption than the lower. So there was an OPG provided. I'm going to show you the OPG here. It was a similar OPG. And now do you see the amount of bone loss around the teeth, both in upper as well as the lower arches? Can everyone appreciate it? The amount of bone loss you can appreciate is somewhere more than middle third or up to into the apical third as well. As you will move along with me in the perio week also, you will learn the staging and grading. But when we start the ultimate advanced file volume 2 classes, I will be doing only 4 to 5 pages per class. That would mean only 4 to 5 SBQs per class. That will give me enough time to focus on each SBQ and the concept behind it, teach you the rash technique, how to apply it, and bring the concepts from hot notes, from the power notes, and apply to it, right? So everybody can appreciate the amount of bone loss is up to the apical third, also more than middle third in this one, right? So everybody can safely say it is more than 33% bone loss in the entire mouth. This is more than 50, 60%, 70% bone loss, right? Everybody agrees with that. Now, the term given is severe, right? Or moderate or mild. So we know that the mild, moderate, severe was the older classification. We also know that, right? But you know what? In the latest staging and grading, the severity is given, still given, right? Yes, ADC sample paper questions, Sufia, they're all part of MMF and UAF, all the questions. Okay. So now mild, moderate, severe was the older classification, but even the newer staging and grading, stage 1, 2, 3, and 4 are given and defined as your mild, moderate, severe. If you have noticed and watched it carefully, do you want me to show it to you? Now, these are your power notes. After you watch all my classes of UAF1 or UAF2, you will be provided power notes like this. So suppose you've watched my live class and then once you have revised it also by watching it. But if you don't have enough time to watch it again, you will be provided these power notes where all the explanation of each SBQ will be provided to you with references underneath these power notes. So now in the last month, say you don't have time to revise all the classes. Is that right? In the 5th month, you will not have time to go back to all the classes and watch them again. Is that right or wrong? Then you will want maybe within few days to revise the entire file. This is how your power notes will help you in the last 10 days to completely review all the important questions. UAF1 and UAF2. And Mega Master file explanations are also provided now. They are part of your Mega Master mocks. Has anyone seen it yet? Anyone here who has taken a Mega Master file mock on the app and has seen that we have added the explanations under there as well? So now all your question banks, whether it be Winning Edge Q Bank, Mega Master file, Ultimate Advanced File 1, Ultimate Advanced File 2, every single question bank comes with its explanation, not just classes, explanations. You seen that? So that's the hard work, providing lectures every time for the new questions, providing references every time, and then providing that as written text to save your time before the examination. You see that? If you can't watch it live and it goes on the app, under the app, we will create a live classes section. This is your study plan, which has the pre-existing webinars, right? And the webinars are mentioned on your study plan. But under that, we will create another section now from October 1st week when the live classes will start. That section will be called live classes internal, live classes public, and live classes tutor support. Right? And so we have three kinds of live classes. One internal, which is the Ultimate Advanced File Volume 2. One will be live public, which will go live on Facebook also, which are free classes. That section will be created separate because of academic sessions. And another Monday and Sunday, you have tutor support class. Dr. Akers, Dr. Kalai, and Dr. Anj take that. So those people who find it hard to read themselves and like hot notes are too much. So the tutors will help you revise hot notes every weekend with them. ACRS on Monday will help you do the guidelines, whether therapeutic guidelines, trauma guidelines, code of conduct, infection control guidelines. So you have all those lectures already on the app. As you see under the webinar, you have therapeutic guidelines, you have infection control guideline classes, right? But now the tutors will also help you review those things. So everywhere you have a 360-degree support provided. It's up to you what you pick and leave. You don't have to compulsorily do everything. It is a 300% program. And even if you do 1/3 of it, you're there. Just do the complete 22-week study plan on top and do all the mocks required. Your tutor support classes are only to reinforce your preparation and provide you extra support, right? So my Tuesdays and Thursdays sessions, they will include everything, but tutors will help you revise the hot notes and guidelines. So this is where your live class sections will be created. If you miss the live classes, you can follow them here. Now coming back to the power notes, and as you told me, you prefer reading more than watching classes. Suppose you attended the live or maybe just watched it once, but now later on you don't want to focus on the classes more. This is your tool now, power notes. It will show you the SBQ first, simple. So we have created those files. We will give you the entire SBQ here, right? And then the entire explanation of each question with the references will also be provided, right? So this is your reading material. So now do you see everyone here, stage 1, stage 2 and stage 3 have the mild, moderate and severe given underneath. Everybody, can you appreciate it? So mild, moderate and severe may have been the older concept, but it is still infused in the latest staging and grading classification. It is one nuance that can be easily missed out, but do you see how the initial, moderate, severe and advanced terms has been given to you? Most of the people focus on this second table, but we have taught you this paragraph also, which was far deeper inside that entire guideline and the classification article that came in, and it can be easily missed out. Everybody give me yes or no if you see this nuance could have been easily missed out, but in exam questions are getting asked for advanced term, severe term, moderate term, initial term, and you must know what each stage stands for. So now the stage 3 is severe, stage 4 is advanced, and if it is more than 33% bone loss, then it comes under the stage 3. Tooth loss should be greater than 4, and then probing depths higher, attachment loss 5 mm or more. So our patient is somewhat in stage 3 or 4, safe to say. Can everyone agree with that? Now, if you agree with that, would you put him in mild or moderate or severe now? Easy? Simple or not? Tell me. Was it easy now with the references, with the understanding? Is it easy or not? Answer would be severe bone loss. Now, the same concept which you will revise in the power notes, first entirely has been taught to you in your perio hot notes. So when you go to the periodontology, so you don't need Carenza, you don't need the textbooks, because this is your ADC Bible. These hot notes are your ADC Bible. So those who want to read, and you are asking about reading, every subject is 100, 200 page also somewhat. Perio is still, I would say, lightest on the number of pages. Prosto is 116. Operative oral medicine, they're huge. compilation. So this is your reading material. So now when you go to the periodontitis staging and grading hot note, even before watching the class, when you will start preparing the hot notes, you will start learning about the entire definition, how to estimate with the, attachment loss. What is attachment loss? Every concept is explained here. Can you see that and appreciate that? Simplified. You don't have to read a 13-page article. We have summarized that 13-page article into these 4-5 pages here. Staging and grading. The severity factors, the complexity factors, the rate of progression, which is your grading, all has been explained here in just 5 to 6 pages. Right? So this is what the work has been done for you. If this entire staging and grading article was 13 pages, it has been concised and highlighted with important information for you in 4 to 5 pages. So now you see why we are not suggesting go read all the textbooks in 5 months. Impractical, completely impractical approach. Coming to the question again, you could now solve this question, everybody. You could solve this question seeing severity and not getting taken aback that why is it asking me mild, moderate, severe? It's an old classification. I only know the staging now. I've shown you the detail that how in staging also still you can accommodate the mild, moderate, and severe. Right? Everybody understood? Priyanka, I'll take that concept later, the question later. First of all, tell me this question, concept understood? You could answer this question based on the hot notes, concepts, and everything, right? Okay, let's move down. What would be the reason of mobility in tooth number 25? An OPG was shown which was similar and there was some bone loss, somewhat similar bone loss, but it wasn't supra-erupted. Now, what could be the reason for the mobility in a periodontally affected tooth? So any tooth which gets periodontally affected initially would have attachment loss. Then it would be also having some kind of horizontal bone loss or vertical bone loss, depending upon the causative factors, right? So attachment loss along with the bone loss are two ways where a periodontally affected tooth loses its attachment apparatus. Is that right? Everybody? Does that make sense? The concept is making sense. It's not attachment loss alone because as the the tooth loses attachment, bone loss starts to occur. So they are kind of like a parallel mechanisms. And that is why just alone severe bone loss or just attachment loss separately given will not be the best answer, but combined together, the tooth is losing its attachment and losing the attached bone. That is a combined reason to give mobility in any periodontally affected tooth. It is not a split root. What is a split root? Another term for vertical root fracture. Is this tooth any post-treated tooth or is there any heavy existing restoration there where could have been a cracked tooth propagated into the root? So do we have any suspicion here arising for it to be a split tooth or a VRF? No, right? Then there is no, even if supra-eruption is there, even if the opposing tooth was not present, and if can supra-eruption alone lead to mobility unless there is an attachment loss and bone loss? No, right? So that is why amongst the given options, bone loss with attachment loss is the reason for mobility in any periodontally affected tooth. Grade 3 mobility was seen in respect to 2.5. You plan to extract 2.5, but what is the preferred impression material if you want to obtain the final cast to fabricate prosthesis? So you want to extract it after and you want to do it first like an immediate denture and extract later, right? So in the severe mobility cases, you might have to take out the impression by slowly flexing it around the tooth, not with a snap. Is that right? Is that right? Priyanka, mucostatic would not be the correct term to use here. I'll tell you why, because it is a hard tissue that you're dealing with, not mucosa. Mucostatic is absolutely an indication for a PVS, light body impression material, when you're doing the window technique in a flabby, resorbed tissue, right? So resorbed maxillary anterior area where there is flabby tissue, hyperplastic tissue. Absolutely, yes, you're requiring a mucostatic impression technique, and the material used is also the same. But here you will not use that term because it is a hard tissue, the tooth you're using it for the dental impression. So here, again, the reasoning is same, that you require the material to have that tear strength, flexibility and accuracy to come back to its original strength after you have flexed it around the tooth to prevent its accidental extraction. So alginate has that flexibility, but does it have a tear strength? Tell me that. Alginate absolutely has that flexibility, but would it have that tear strength? You require to take out the alginate impression always with a snap. Is that right? And snap can make happen accidental extraction. Is that right? So that is why, and zinc oxide eugenol is a rigid impression for your edentulous ridges, not that polyether, very rigid again. Best for your implants, but not for your teeth, very rigid. So it's PVS. Is that right? So answer will become PVS here. The light body PVS will be your impression material. Now you decide to give RPD to this patient. What's your choice of material to give the RPD? Now choosing a material for RPD, now tell me, will McCracken give you an actual answer based on varied histories of the patient's periodontal condition, patient's financial conditions, patient's other problems, bone related problems, lot of other patients' history factors? Will McCracken or Delosey will give you those answers? You will have to do the entire textbook to probably maybe connect the dots, but that, imagine the ocean that these textbooks are, right? So what we have done here is, in the removable partial denture hot notes, if you can see and appreciate, the sources are mentioned here. Can you see the source? McCracken, RPD manual by Delosey, something from the internet, and BDJ articles, right? So now you see the best RPD materials, best RPD resources have been infused together only from the ADC relevant syllabus and created these beautiful hot notes for your classification, your types, your parts of RPD, the connectors, the minor connectors, for what class to use for each situation, where to give your indirect retainers, the fulcrum lines. Every relevant concept has been explained to you, where you would use what kind of major connector, what kind of minor connector, what kind of clasp. Now can you see that? So everything from McCracken's, everything from Delosey, everything from BDJ articles. But do you now, tell me, have to read all those huge textbooks or only read these 10 pages and 15 pages and your ADC relevant material is prepared? See this? Now you also have important article classes with me. So when you go to the Prosto week, you will also see that these concepts have been taught to you as your RPD part 1 and RPD part 2 class. So all the parts, Kennedy classifications, and then clasps, everything is covered also. So there are notes also. So if you are a reader, please read from hot notes. But if you are somebody who wants to grasp information, that because I break down each concept and I serve you bite-sized information, make you understand and learn the concept, so that next time you see a variation in the examination, you're not worried, because I am not a kind of mentor who would come and say alpha, beta, delta, charlie, a, b, c, d and be done with my job, right? So my job is not to serve you A, B, C, D. My job is to serve you concepts, not just to serve you, but also to assure that you understand, grasp, memorize, and then can apply to the questions. So with RASH technique, I will tell you how to even apply it to the questions. But that RASH technique, I'll only teach you in our internal ultimate advanced file classes. Okay? Now, you decided to give RPD to the patient. What's your choice of material that you will use to give the RPD? Now, this patient has very severe periodontitis. Even after treatment and few extractions of mobile teeth, we are still not sure whether the patient's condition will be stabilized or not. We would require something which can be used to add on teeth in future if the patient loses more teeth. Is that right? But if you give a metal-based RPD, that flexibility, that ease will be lost. So what will be the best answer here? Both acrylic dentures would be good, because in both ridges, there are still severe bone loss and stage 3 or stage 4 periodontitis. You have decided to take an occlusal registration. What is the use of Facebook to record it before doing it? So why would you use Facebook? It helps to orient maxillary cast to the patient's anatomical reference points. It helps to find the difference between the centric relation or centric occlusion, and for maxillary and mandibular relationship establishment. Now, C option cannot be the answer, Nikita. Why? Because that is a definition of any jaw relation, right? All your orientation, horizontal and centric, all kinds of your jaw relation are maxilla and mandibular relationship. Is that correct, Nikita? Would you agree with that? Whether it's your orientation jaw relation, centric jaw relation, right, or your horizontal jaw relationship or vertical, it is all mandible versus maxilla relationship with mandible. That is why it's a very generic term used to describe the all kinds of jaw relationship. But Facebook is not used for doing all kinds of jaw relationship, isn't it? Do we use it for all kinds of jaw relationship? Facebook? No, right? So that is why C will not fit to the use of Facebook, because that defines all jaw relations. Facebook is not for all jaw relations. Which jaw relation is done by the Facebook? Orientation jaw relation. And in orientation jaw relationship, you orient the maxilla to the anatomical reference points. Can anyone in the class here tell me what those reference points are? Hinge axis, condylar axis, is that right? In the external auditory meatus, where your earpieces are attached. So at orienting the maxilla in patient's reference to the anatomical points of hinge axis, condylar axis. So that is your orientation jaw relationship, which is recorded using your Facebook. It is also not used for centric relationship. Centric is a horizontal jaw relationship where the maxilla and mandible orient horizontally. And then there is a vertical jaw relationship, which is the vertical height of the teeth combined together, maxilla and mandible, right? Vertical dimension at occlusion and vertical dimension at rest. VDR is greater than the VDO. VDR minus VDO should be 2 to 3 mm, which is your freeway space. Is that right? If there is an excessive VDO, it will lead to pain on the ridges, right? So these are your jaw relationships: horizontal, orientation, vertical, and centric. Face bow is used for the orientation. C is not the definition of orientation. It is the definition of generic jaw relations. Even B is not the definition of orientation. That is the definition of horizontal jaw relationship, maximal intercuspation, centric relation. How far ahead or behind the mandible would be in compared to the maxilla. And A is the definition of the orientation jaw relationship, and which is why you use a face bow. That is why it becomes your answer. Yes or no, please? Everybody gets it. The concept, understanding, and even the depth of the concept. That is exactly how we are going to do the Ultimate Advanced 5 Volume 2 in our live classes, when we only focus on 4 to 5 pages per class. We'll have 1.5 to 2 hours. We go in depth about each question, in depth about each concept, learn the rash technique, see it with your eyes how it fits every single time. I'm not even touching rash right now. If I start touching the rash, you will see how easier it becomes. But trust me one thing, rash will not work unless your foundation and concepts are clear. Can you remember this one? Rash is no magical pill. It is magical, yes, but it is not without concepts. So your base has to be prepared with your hot notes, with your power notes, and then your rash in the questions will become a magical pill. Impression material was initially washed in water and after that immersed in what for disinfection. So rinsing with water, but disinfection is done with infection control guideline reference with your diluted detergent. So after rinsing the traces of saliva, blood, you will apply a diluted detergent. Now there is so much. I have given you all the infection control guideline classes. They are beautifully explained by completely imagining the scenarios in the clinic. The highlights have been provided to you. The classes are provided to you. Now imagine getting mind maps on your ICG. Let me show you your mind maps now. Another magical feature. Now I showed you, everybody saw the hot notes on RPD, hot notes on staging and grading. You all did, yes? 5 to 6 pages on staging and grading, 10-15 pages on RPD, which is a huge chapter, like 3 books combined. Now imagine the last week before. Now it's few days before the exam. And all you want to do is quickly in 10 minutes revise each chapter. That's what you want to do? Revise each chapter in 10 minutes? Yes or no? Is my sound not clear? Am I audible? Is it good now? Can you all hear me? It's back? All right. So I'm just saying, imagine in the last 5 days or 1 week when you want to do all the preparation and you want to give only 10 minutes to per hot topic. Now, do you see here the staging and grading, which was 5 pages there, one single mind map? And you have all the diagnostic criteria, all the different forms of periodontitis, staging, all the staging types, what are the factors, what are the complexity factors, what is the grading criteria, understanding attachment loss, characters of necrotizing, determining the initial stages, every single concept on one single page as a mind map. So imagine doing in depth the entire hot note during the first 2-3 months. So now do you even visualize how the beautiful arrangement and alignment of the 5 months is going to be for you? Can you appreciate the 5 months progression, how it will be? First 2 months you will focus on preparing in depth each subject. From third month your revisions will start, your mega masters, UAF will start. And by the fourth month you will be teaching me, and by fifth month before the examination you would have mastered all the files, you would have mastered all the notes, and you would be spending your time taking so many mocks, enhancing your scores from 70 to 80, 80 to 90, and doing these 10 minutes revisions of mind maps. Now that RPD, which you had 15, 20 pages for in these 3, 4 mind maps, these 4 mind maps giving you complete overview of 3 textbooks related information, which comes directly in exam as questions. Do you see the power of the material that is provided here? Can everybody appreciate how stage by stage? So first 2 months, your app, your classes, your mocks, your reading of hot notes, 2 to 3 months, repeated watching, repeated reading from your hot notes, and repeated revision of power notes, and taking the mocks every single day, so many mocks. And then in the fourth and the fifth month, you have repeated, you have revised so much that in the last few weeks, these mind maps will give you that last power tool to quickly revise everything. Because people struggle in the end with that. They don't have time to review and revise everything because they're busy doing the Karenza McCracken and Walton and Paul Abbott and everything. Imagine somebody doing all the textbooks. Would they even have the time to first pick out the information which gets asked in the exam? First of all, find out what comes in the exam, apply it to the examination questions. First of all, nobody has the amount of questions that we do. At Winsport only we do the 5,000 to 6,000 questions. Yes, it scares people initially that it is intensive, but this is what makes the examination easy. And that is why we boast of that. And that is why we allow you to just say whatever, because we know we give you that Winspurt confidence with this level of intense preparation. And we trickle it down the information collection from the textbooks, from the guidelines, from all the articles, into the hot notes, into the power notes, and then into your mind maps. Now imagine having mind maps like these on each topic of infection control guidelines in the end. Imagine having that power. Right? So we will be providing you the mind maps on the ICG also. So for the first 4 months, you will read ICG every month, one time yourself, fully from the guidelines. But for the last 2 weeks, when you get the mind maps, all those 4 revisions that you would have done, you will be able to quickly review it before the examination. Similarly, the mind maps will be provided to you on the ODEL chapters. So you can watch all the ODEL cases on the app initially as part of your study plan. But in the end, you will have all the ODEL mind maps. Every case will be given 1 or 2 mind maps. 10 minutes you will get. Priyanka, we don't have ICG hot notes. So I'm thinking either to give hot notes for ICG or mind maps. But I think because the information is very crisp already, ICG is what, 80-90 page only. So we can give you 80-90 slides like that, basically, which will give you like a visual appearance. Because what happens is the guideline is very boring and monotonous, right? There is so much information, but if we put it into these colorful boxes, give you headings, it will be a good memory tool. So even hot note will still look like a theory thing, right, Priyanka? And it's not too intense. So we can straightway go from the ICG guideline to the mind map. That is why I was skipping the hot note point. No need. We can put that much text in the hot notes only per page. So say if we have a 90-page file, I can compile 2-page information in one mind map. It will save you the time in the last 2 weeks and quickly give you a visual memorization of every single concept, which is very easy to miss when you're doing this boring, monotonous, black and white, highlighted guideline, right? Isn't that right? So that is why ICG mind maps and ODEL mind maps will only be released in the last month, last 2 to 3 weeks, Nikita. Because before that, I want you to focus on reading the guidelines fully, entirely. Even on trauma guidelines, I'm bringing you the mind map. Because even trauma guideline is very volatile, very, very volatile. Remembering all the follow-up dates and times, when to remove splints, complicated injuries, right? Combined injuries, all that. Exactly, Priyanka. So that is why I want you to start with intensity. Then I have given you even the tools where you can revise easily also. So I do make you do intense work, but then I also give you tools to help you ease out during the revision period, right? So I got you covered at every stage. But this is how winners are made. Isn't that true? So imagine at the end having the mind maps for RPDs and every single imaginable hot topic that comes in exam. So when you're going to the examination for 280 questions and we have around 300 hot topics preparing you like that, and every SBQ is going to come from one of the hot topics or one of the mind map. Imagine, you will get that confidence or not. Think about it. Would you have that confidence or not that your March 25 candidates had? Barca, mind maps will only be done and added to the study plan in the last month. Because before mind maps, you have to read the power notes and hot notes. And hot notes, Mubaraka, every Sunday, Dr. Kalai, Anj, or Dr. Akis will meet you and help you read all the hot notes. They will help you revise and practice and understand all the hot notes yourself. So if you can't read it by yourself, tutors will every week come and help you with that. Hima, so online classes will be Tuesdays and Thursdays with me, and Mondays and Sundays with tutors. So tutors will help you revise the hot notes and guidelines. I will take on Tuesday a public session, which will be either academic or ADC content related, like how to prepare. And Thursdays will be our internal classes, which is Ultimate Advanced File Volume 2, which I'm just showing. We are doing this SBQ from. Exactly, Tanvir. I'm super excited for the ODEL mind maps. I'm excited for the ICG mind maps. And I'm also super excited for your trauma guideline mind maps. And once the new TG edition comes, I'm going to give you the hot notes and the mind maps on TG also. That would be the end deal. I'm just waiting for the fourth edition. And then you will be like, life is set, right? All right, till the new edition comes, you have all the TG classes word for word and tutor class for TG revision. So even before that, even before the TG hot notes and mind maps come, you have my page by page classes on TG where I've explained every single TG page and concept. And every week you will have one tutor support class to help you even revise and kind of like a Viva on a TG. So ACUS will start taking your Viva on TG from the week one only. You are not going to be spared. You have to be on your toes. So I'll tell ACUS she'll take a Viva kind of class every week on Mondays. She will do a Viva for you from October. Are you ready for that? Because you're already doing TG questions on group WhatsApp. We assign you pages, right? So every day on the groups you're taking TG page wise questions. There we are challenging you. Every Monday from October we will start taking your Viva on TG. It will be your Viva every week to show up. For the page numbers, we will assign you pages. You will watch these pages classes and you will show up on the tutor class and your Viva would be taken so that you're answerable and we will hold you accountable from first day. Yes, Charu, that's the point. See, when we got you covered from every single day from the first day itself. Imagine, you will not let you fall, will not let you fall behind. So even you don't even have to worry about your own motivation. We are holding you accountable, right? Now I don't think TG4 will be applicable because it's too late now. Even when all the ICG new came, it was somewhere in September, October. It came earlier, but ADC announces and then it starts applying to the exam. So don't worry about that. And you asked me what is the assessment that I'm talking about, right? On the study plan, and what it means on assess on the study plan. So when you go to the study plan here, you see the watch, read, and assess strategy. That is the three components and pillars of INSPIRT preparation strategy. Watch, read, and assess. I just showed you the classes, right? Watch classes are there on the app. I showed you under each week plan. So when you go on each week study plan, you have the classes attached there. So every week study plan on the PDF is classes are attached here. This you have to watch. Now for read also, and if you see, you have to read these every day, hot notes or power notes. Those power notes are also provided to you on the app. If you go and see here, for example, on your smart doc section, what you have to read on the study plan, suppose you have to read a power note of a particular subject, you will just type that. Maybe you have to read prosto power note, for example, right? So I'll go and prostodontics UAF, which is the UAF power note based on your study plan, or this is your volume 2 power note. Whatever pages you have to read, we have assigned that. You will read and prepare from that. So read part is also given on the study plan, whether hot notes have to be read, whether ultimate advanced file, what pages, what topic, everything is dedicated. You do not have to use single brain cell on that. That what do I do today? Trust me, you will wake up and like, oh my God, I have too much to do today. That is your thought, not what do I do today. Understood? So I want you all to wake up knowing what you have to do, not what do I do today. There is no question mark. That is how organized, that is how planned in future we are, right? This is a roadmap where you know every single day ahead of your time. And that's how we keep you ahead of the curve. And then there is the assess part, which is the third pillar, which is the mocks. So these tests which are mentioned here, and again, you will have to take them on the app. So for the first week, you will go on the first week, and on that first week, on day 7, all the mocks or assessment tests are given, which are to be taken in that week. So for example, this is week 3, right? If I go to the study plan again and I show you week 3, I have to take the UF test, the winning edge Q bank. It is still to be added, so we will add it there on the app. So you have to take the ultimate advanced file test from page number 21 to 25 in that week. Then page number 26 to 30 is also due that week. 35, 31 to 35 is also due that week. Then winning edge Q bank is also due that week, and prosto subject wise mock is also due that week. Is that right? So when you open up and you see this is my week 3 Wednesday, and I have to do the UF page number 31 to 35, right? And then you would simply go to the app again. Week 3, I have to do on Wednesday, UAF page 31 to 35. It is mocks are all added on the same week on day 7. So you can find it there. And on that particular day, whatever mock or assessment is given to you, you will go on the app and you will take that quiz. Understood? And this is how your every single day watch, read, assess is given. I'm so happy, Swag, and that is why I wanted to do this lecture and session. I wanted you all who have already enrolled and those who are wanting to enroll now, and now you can also join now because that is the beginning of March 26 preparation. This is how the course has already begun. The Ultimate Advanced File Volume 2 are still in the first week of October. We're getting there and I'm slowly building your momentum. Week 9 onwards, Gifty, your revisions will start. So from first 2 weeks, you will prepare the base, week 1 to week 8. Week 9 onwards, your revisions start in the program. And by week 18, yeah, by 9 to 18, another 8 to 9 weeks, you would have done 2 more revisions. And in the last month, you will again do 2 more revisions. So you will go to the exam 5 revisions of every concept. My program includes revisions. You don't have to plan any single thing. You just have to trust the process. right? So let's answer this question coming back. Impression material was if it's washed, then what would you use for the disinfection? Saline, glutaraldehyde, hypo, or diluted detergent? Answer is diluted detergents. That's mandatory. Sodium hypo is only used in MRSA situation, high risk situation, as an additional step. It never replaces the detergent. Understood? Everybody, the concept understood? I will do all these questions again in the UF2 also and with your rash technique to make it even further easier. Now, when should you change the impression disinfection solution? Now, ICG doesn't cover it. No resources cover it. And that's again where the hard work comes in. That I will find the references for you. I will find the resources for you. Because I showed you Riddhi on the ICG, after rinsing, what has to be the first applied agent? Glutaraldehyde again is your chemical disinfectant, right? But not the indicated for the impression. In the impression, first water, then diluted detergent. These are the guidelines. You will not question them. You will have to memorize them, even in sequencing. Right, Riddhi? And that is why the guidelines say when in your higher risk or MRSA situation, then you can use your sodium hypochlorite as an adjunct. But again, not as your first step. It will not replace your diluted detergent. Understood? Riddhi, I hope you got your answer. You have to choose the agents which are preferred in the guidelines. That is why the research and knowing and understanding, and you need somebody to explain ICG word by word to you. And that is what I have already done in the classes here. So as you have word by word, page by page TG classes, you also have ICG classes here. See here, Riddhi? And they are part of your study plan. So again, you don't have to wonder, oh, when will I read this? When will I practice this? And we have given you mocks also, 2 ICG mocks to practice the infection control guidelines. Every single class will explain the concept. And this is part of the study plan. So you don't even have to worry, when will I do this? How many times will I do this? That's already given and dictated in your study plan. Understood? Everybody, is this helpful or not? Tell me how much more hand holding can be done. And if it can be done, just let me know on my WhatsApp because I will hold your hands even more if they can be held more. Right? And that is exactly I have arrived here. Every single time, every single batch, thousands and thousands of students messaged me, Jigs do this, Jigs do that, Jigs give us this, give us that. And I kept delivering and I kept delivering and I brick by brick I made this. People want to copy this app, they want to know where I work, where this app works from, what is given on this, they want access to it. They will go out and ask my students, give me access for a few days. It's all a compliment for me. But I did not have any single app to go to and copy. I built it brick by brick by every single student's feedback. So Winsport is not something that has lifted off as a competition, lifted off, oh, Jigyasa is doing this, Winsport is doing this, competition is doing this, so we have to come up with this. This was created by the emotions, the needs, the actual need of the ADC candidates over the last 9 years. And something that is built with that human feedback, requirement, and need talks for itself. And that is what people try to copy and recreate. So I'm super proud that this app, this entire program is a master piece that everybody wants to just copy paste and recreate. But you know that when a masterpiece is created over the years, it has been genuinely created by every single student's feedback. So anytime you have a feedback for me, don't hold it back. Don't think I'll say I've already given you so much, what else you want? No. My question to you every day is, what else can I do for you? Right? So my everyday job is to, what else can I give you? How can I improve it? So anyone who joined before, they are doing they might be on week 2 or 3, Priyanka. Those who are joining today, they will start with week 1, day 1. In October, we will officially start with week 1, day 1. So anyone having the backlog will be able to catch up as well. That is why this program is so flexible. You don't have to worry. You start with your own week 1, day 1 when you start, and do extra hours to catch up. From October first week, we'll officially lift the week 1, day 1. But those who are already ahead, they will continue to do the ahead weeks only. You will continue with your own plan. Only the UAF classes will be extra for you. So now coming to this question, which I said that if you don't know when to replace the disinfectant solution, so what should be the best answer? Manufacturer's instructions, when it becomes visibly soiled, or after every patient or every impression dip, or at least once a day, or when it appears or again visibly soiled. So option B and E are practically same. Jasmine, option B and E are practically same or not? Look soiled or visibly soiled is same, right? Yes, so B and E are no different. But let's see, what are the references? So present study demonstrates the importance of having a second level disinfection. The second level disinfection is what? After using your water and your diluted detergent, then the second level of disinfection, either with hypo, right? Or here in this case, benzyl, your Kvex, right? Wait a second, let me scroll it. Now, so manufacturer's instruction, following the manufacturer's instruction in terms of pre-rinsing impression for 3 minutes before disinfection, it's an important factor in maintaining the efficacy of disinfecting solution, right? And the recommendation says, manufacturer's recommendation says for Kvex, which is benzalkonium chloride, is to replace it every week. But that has been said by the manufacturers, but there was testing done for the culture, right? Even if it's not visibly soiled yet, the culture testing was done. So usually it says that for these manufacturer of one of the commonly used back solutions, Kvex Imprisafe, claims that Kvex Imprisafe can be used for 7 days or until visibly contaminated. These are the recommendations. That is why visibly soiled or up to a week. Both answers are correct as per your manufacturer's instruction. Is that right? But what should be the best answer? But the studies analyzed the changes in the efficacy of BAC with repeated uses of the solution and with different impression materials. And it was found, it was unclear that when it should be changed, right? And there were not clear guidelines, and it was ambiguous to how dirty you want it to look like, right? When you're saying visibly dirty, how dirty? So there were ambiguous recommendations from the manufacturers. So the recent literature has suggested to replace it at least once daily. Okay, so I'm going to show you here. So the present study informs clinicians that the KVX Empresafe disinfection solutions needs to be changed more frequently than your manufacturer's advices. So manufacturer advices were two things: once a week or visibly dirty. But the recommendation is that it should be changed more frequently, daily rather than weekly. So now what will be your best answer? Visibly dirty, visibly soiled, or your once a week, or after every patient, or just follow your manufacturer instructions, which are close to a week. So then the answer becomes option D. Got your answers now? And the reference link will always, if it's an external reference, not given in your hot notes or not in your power notes, it will be provided as your comment section here as a link to go to and watch again. Now, suppose the next time you want to review the class, this class, and you have no time to watch the class again, 1.5 hours, and you want to quickly revise this in 30 minutes, 1/3 of the time, you will go to your power notes. You will practically just go to your power notes every single time you have done Ultimate Advanced File Volume 2 classes with me, or UAF class or MMF class, and you don't want to watch the class again and spend 2 hours to revise, you will go on the power notes, and every single questions explanation that I just gave you has been summarized here. Can you appreciate the beauty that power notes are? All the class explanations that I gave you are here. Can you all see? Jaw relationship questions, severe periodontitis question, material for RPD selection, material for impression material selection, the initial staging and grading selection, and this diluting disinfectant, diluted detergent use, the ICG screenshot for your quick review. Nothing left on imagination. You're not left with empty, unanswered files. What you have is the class, what you provided with is references, and then you're provided with this most powerful tool called Power Notes. After every class of a 2-hour session, if you want to revise that information within 30 minutes, this is your power tool. All the snippets of the references shown in the class here at your fingertips. Who is going to find all those quick references for you in 2 pages? All that I showed to you in 2 hours, within 10 minutes, you have it on your fingertips. See the power of your power notes? That is how every week at a time, by reading these references, by reading these power notes, hot notes, and mind maps, you will get that confidence, the Winspert confidence of doing the exam, answering all the variations, the new questions, the old questions, the familiar questions, the variations with Winspert confidence. So tell me, give me a big yes if you're ready to acquire, ready to achieve that superior Winspert confidence before the examination, without having to worry what textbook do I read, without having to worry what am I going to do today. So now, as I told you, there's going to be a third surprise, and I promised you I want to take the candidates who are in their 50s, who are in their 60s, or who are in their 70s in the top ranks, in the 80 plus and 90 plus. At Winspert, over the years, I have developed a technique of improving the scores. Now, for our enrolled candidates, we will start Winspert Inner Circle session, where you will be given the tools, and it would be completely one-on-one, right? So with the tutors, you will have a one-on-one session known as Winspert Inner Circle, where we will train you, where we'll see your scores, and we'll give you a time-tested, proven formula to improve your score to 80s and 90s. So you will get a one-on-one Winspert Inner Circle call. And sometimes you would not even know that you need that call, but you will be sent a notification that you require that call, right? So you can ask for the Inner Circle call also, and we can also pick you if we see your daily doubts and we think that you require extra help. That is how personal the program will get now. But for that, you will be needing to do one thing for me and give me promise and give me yes here on the chat and Facebook as well as on Zoom. If you want to get a Winspert Inner Circle call, would you daily, every day send me doubts starting today on WhatsApp one-on-one doubt support? Would you start asking daily questions? Yes or no, please? Because if you do not, how would I know that you are a candidate for the Inner Circle? So one thing I want daily personal doubts from each of you, so I know that you require the lifting and jumps in your scores. That is how personal we are going to get for each batch this time onwards. So this is no more 1,000 students. Yes, there will be a community of thousands around you. So we will work with you on a community level, but we will also, and we have been working on you already on a personal level with our personal doubt support. Now we'll take it one step forward by taking you into our inner circle. We will give you personal calls and we will tell you face to face, this is your score. This is not going to get you a pass. This you must do, and at this point only to get a pass. So we'll not wait for your grand mock scores to tell you, oh, you're too late, or for you to realize, oh, am I too late? We will start with the first week itself and now itself to give you that extra edge in hand so that you don't wait for the grand mock to get a reality check. Do you want to get a reality check before just close to exam, or you want to get a reality check now? The tools now so that you can make the best of this time now. So learn those techniques now with my expert tutors who have studied with me, who have mastered those techniques with me, and who got all 4 A's with this Winspurt strategy. That's where your tutors are coming from, by giving 10 to 12 hours of studying, and even now they're studying for you. Even now they haven't stopped preparing for you. So I tell my tutors same thing, that you cannot be a Winspur tutor if you're not studying yourself every day. That is it. So now we want to give and pass on that legacy of improving your scores from 50s to 85 plus by pulling you all in our Winspur inner circle. So I will be looking forward to each one of you for our inner circle calls. But I will need, see those who are already getting 80s and 90s. If you want to join an inner circle call, it would be just, we will just congratulate you. We will celebrate you. We will tell you to keep doing what you're doing. We will just reinforce that. But actually, who needs this call is somebody who's in 50s, somebody who's in 60s, 70s, and struggling to get to that 85 plus beautiful window. And we will take you there with our Winspur inner circle. So you all are welcome in our inner circle. And I'll see you there, and I'll give you time tested legacy techniques to crack the examination with 4 A's. So we can lift that burden off your head, share it with you shoulder to shoulder, and let you believe and know that you're not alone in this. How do we know if we are in 50s and 80s even before the course has started? Swag, that is how you know at Winspurt in the first day itself. When you start doing the program and you have the weekly plan, under each week, every single day you have your assessments and you have your subject-wise mocks waiting for you. So from first day itself, when you tell me your operative subject-wise mock score, endodontics mock score. So in 7 days, you will be entitled for, you will be eligible for an inner circle called swag. Got it? So not even, you don't even have to wait for the course to start. The course has started for you and the operative subject wise mock is here. So on your assessment scores, if you're getting 50, 60, 70s, the Winspurt inner circle is for you. So how excited you all are for that inner circle call, and knowing that it's, you don't have to be great. We will take you to greatness. Nobody is born great. Greatness is just a mastery and practice. Discipline, sincerity, every single day without fail. No one is born great. Trust me, anyone who's great and tells you, oh, I'm born, it's a gift and all of that, it's all BS. Nobody is born great. Everybody is born with that potential to be great. Every single one of us is born with that potential. And it's my job to bring out that potential, utilize that potential, and show you just how great you are. So yes, if somebody is born great, then everyone is, but no one's special. Everyone is born with that greatness potential, It just takes discipline, it takes sincerity, it takes honesty, authenticity, positivity, mindset, and a good nurturing hand to support you and guide you and mentor you. And then you take off. And then after a few months, you will learn this and you will not even need me. So that's exactly the kind of support I want to offer you, that you don't even need me after this point, right? You have learned that mastery, how to bring out the greatness in you. So looking forward to have you join us and unleash the greatness within you, become the winner that's already in you. And we got you covered from every single post. From 360 degrees, you will be fully supported with me and my team. Right? So thank you so much, guys. Have a beautiful, beautiful evening. And when the quiz, wait, this question. Wait, Mubaraka, let me. I always need you to, Mubaraka. Priyanka, let me take your question. The Q Bank, when the Q Bank is released, do we have to do the revision of 1000 again? Classes, yes. Classes, yes. Keep watching the classes. But now the 1000 and the past paper mocks will be removed from the app, Priyanka. So you will take the assessment. And I'm weeks ahead. Do I have to follow weekly plan or study plan of that particular week? When the course starts, no, you will continue with your old week wherever you are. Only keep checking and drop down each week before. If extra classes are added and you have not marked them complete, only do those classes. Okay? All right. Thank you so much, guys. I hope it was helpful and I hope it was elaborative enough to know where you're heading, how to utilize every single thing that there is on the app. So I hope it was quite informative and it eased up your worries that, oh, I'm starting, I don't even know. So this is how you start. This is your compass. Thank you so much. I'm truly grateful to you, Jasmine. Yes, thousands have a beautiful foundation. See, that is why I can replace the textbooks, Nikita. If you watch my 1000 classes, you will not need a single undergrad textbook. That is my guarantee. I take so much pride in the 1000 classes, you know that? And they are so old, but still so relevant. Every single time the course begins, people think my those advanced classes are ahead of time. The advanced classes, the RPD, the implants, the sleep apnea. A lot of students may think that yes, I cover a lot of advanced concepts, but you know what I love the most? The basics, the thousands. They are the true essence of this program. They are what brush up your all your dental knowledge, and then they build the foundation on which you build the advanced concepts. So I really take immense pride in those 1000 classes, and every single time I see and I receive such great messages when the students start doing the program and they start watching the 1000 classes and they are like, where were these classes in the undergrad years? Right? So thank you so much, guys, and truly, truly means a lot for you all to be here. And I wish you all the best. Thank you for showing up, showing that sincerity and discipline. And trust me that you will achieve the greatness. You will achieve success during the examination day. Just show up with this attitude every single day. All right. Thank you so much. Bye. Have a great, great evening. Bye bye, everyone. Take care. Bye.